everyone. Today let us discuss on the topic immunization. I would like to brief on the national immunization schedule, that is the important vaccines that has to be taken from birth until 15 years of age. So before moving into the topic, let us discuss some terms like immunity, vaccine and immunization. What is immunity? Immunity is the ability of an organism to resist a particular infection. For this, our body has an immune system which, by the help of the antibodies, protect our body from various infections. What are vaccines? Vaccines are substances which stimulate our immune system and help in protection against an infectious disease. What is immunization? Immunization is the process by which a person is made immune to a particular infection by the administration of a vaccine. Now let us discuss what are the important vaccines that has to be taken from birth until 15 years of age. Three important vaccines which has to be taken after birth are: the first one is BCG, the second one is hepatitis B, and the third one is the OPV, which is the oral polio vaccine. Now let us discuss briefly regarding each vaccines. The first one which I mentioned was the BCG vaccine. BCG stands for Bacillus, Calmette and Guerin. It is used to provide a protection against an infection called as tuberculosis. What is tuberculosis? Tuberculosis is an infection which is caused by the bacterium called as the Mycobacterium tuberculosis. It primarily affects our lungs. It can also affect the various parts of the human body, including the brain. It is generally administered intradermally, that is beneath the skin. The second important vaccine is hepatitis B vaccine. So what is this hepatitis B vaccine? Hepatitis B vaccine provides protection against hepatitis B infection. So what is this hepatitis B infection? Hepatitis B infection is a viral disease which is caused by the hepatitis B virus. It is mainly transmitted through the body fluids, that is by the sexual contact and also by sharing the injection needles, syringes, and also from mother to baby. So hepatitis B vaccine is used to protect against the hepatitis B infection. The third important vaccine which is administered after birth is the OPV vaccine, which stands for the oral polio vaccine. And it is used to provide a protection against poliomyelitis, which is commonly called as polio. And this polio is also a viral disease. It is caused by the polio virus. It often causes muscle weakness and also results in flaccid paralysis. So these are the three main important vaccines that has to be taken after birth. The next important vaccines which are taken at 6th week are: the first one is the triple antigen vaccine. Triple antigen vaccine, that is the DPT, that stands for diphtheria, pertussis and tetanus. The other vaccines are Hep vaccine, the next dose of hepatitis B vaccine, and the OPV, which is the oral polio vaccine. So the DPT vaccine, hepatitis B vaccine and the Hep vaccine is available in a single formulation called as the pentavac or the pentavalent vaccine. So what is this pentavac vaccine? The pentavalent vaccine is a combination of 3 vaccines which helps in protection against 5 diseases. So what I've mentioned is that the DPT vaccine, the hepatitis B vaccine and the Hep vaccine is available in a single formulation called as the pentavac. And this pentavac helps providing protection against 5 diseases. Now let us discuss briefly regarding the DPT vaccine. So what is DPT vaccine? As I've already mentioned, DPT stands for diphtheria, pertussis and tetanus. This vaccine is a combination of 3 antigens and provide protection against these 3 diseases. What is diphtheria? So diphtheria is an infection which is caused by the strains of Corynebacterium diphtheria, and it can affect our skin or the respiratory tract. So depending upon the part which is affected, the symptoms can also vary. The respiratory symptoms of diphtheria include sore throat, breathing difficulty. The next one is pertussis. Pertussis is also known as whooping cough. It is also a contagious respiratory disease. And tetanus. Tetanus is an infection which is caused by the bacterium called as Clostridium bacterium. It generally enters our body either through a cut or you can get it by stepping onto nail, And the common symptoms of tetanus include tightening of muscles and all over the body, and it can even cause locking of the jaw. The DPT vaccine provides protection against these three infections, that is diphtheria, pertussis, and tetanus. The next vaccine is the Hib vaccine. So what is this Hib vaccine? Hib stands for Haemophilus influenza type B, and this infection is responsible for serious or deadly brain infection in case of young children. So the important vaccines which are taken at 6 weeks are DPT, Hepatitis B vaccine, and Hib vaccine, which is available in a single formulation called as the Pentavac, and the oral polio vaccine. Other two vaccines which are taken at 6th week are PCV and the Rotavac. So what is this PCV and Rotavac vaccines? Rotavac vaccine helps providing protection against the rotaviral diseases, which is a leading cause of serious diarrhea in case of young children. And PCV stands for the pneumococcal vaccine, and this provides protection against the pneumococcal infections. So this Pentavac, PCV, and the Rotavac vaccines have to be taken at 6, 10, and 14 weeks. The next important vaccine which is taken at the 10th month is MMR vaccine. So as we all know, MMR stands for mumps, measles, and rubella. So what are these diseases? Mumps is a viral infection which mainly affects our salivary glands. The common symptoms include swollen and painful salivary glands, fever, headache, loss of appetite, and so on. The next one is the measles. Measles is also an airborne disease, and it is transmitted from the cough and sneezing of an infected person. And the last one is rubella. Rubella is also known as German measles, and it is also a highly contagious viral infection, and it is characterized by the red rashes in the body. The first dose of the MMR is taken at the 10th month, and the subsequent doses of MMR vaccine is taken at the 15th month and between 4 and 4.5 years of age. Next recommended vaccine between 9 months and 12 months of age are the typhoid vaccine and the hepatitis A vaccine. And next comes at the 15th month. At the 15th month, the first dose of the chickenpox vaccine, that is the varicella vaccine, can be taken, and also the booster dose of PCV vaccine is taken. The next vaccines come at the 18th month. At the 18th month, the booster doses of DPT, Hib, and the hepatitis A vaccine are taken. Vaccines which are taken between 4 and 4.5 years of age, and they are the booster doses of DPT, the varicella, that is the chickenpox, the MMR vaccine, and a polio vaccine. The next important vaccines are taken between the age of 10 to 12 years, and that is the Tdap vaccine. So Tdap stands for tetanus, diphtheria, and pertussis. And the other important vaccine which is taken between 10 to 12 years is the HPV vaccine, that is the human papilloma virus vaccine. And this vaccine provides protection against the cervical cancer in case of females. And at the 15 years of age, the TT booster dose is taken. So I would like to give a quick review on all the vaccines which I have mentioned until now. So starting from the first, BCG for tuberculosis, OPV for poliomyelitis, hepatitis B vaccine for hepatitis B infection, DPT for diphtheria, pertussis, and tetanus, Hib vaccine for Haemophilus influenza type B infection, PCV for the pneumococcal infection, MMR for mumps, measles, and rubella, Rotavac for rotaviral infection, PCV vaccine for the typhoid fever, hepatitis A vaccine for the hepatitis A infection, varicella vaccine for the chickenpox, and the HPV vaccine for the human papilloma viral infection. So I hope that this information was helpful to everyone. Thank you for listening. Stay safe and stay healthy, everyone.